Bismillahirrahmanirrahim. Assalamu alaikum. Our topic of discussion is antifungal agents. What is antifungal agents? Those drugs which are used to kill or to suppress the growth of fungus or to inhibit the growth of fungus is called antifungal agents. We have different types of antifungal agents. Systemic antifungal drugs for systemic infection. We classify these antifungal agents on the basis of their site of application. Systemic antifungal drugs for systemic infection. For systemic infections, we have a systemic antifungal drugs. While for for mucocutaneous infection, we have systemic antifungal drugs. Systemic antifungal drugs for mucocutaneous infection, and for skin infection, we have topical antifungal therapy. So let's discuss them one by one. Systemic antifungal drugs for systemic infection. We have amphotericin B, flucytosine, azoles, and echinocandins. But remember these drugs by this short-term formula: AFAI, FAE, amphotericin B, flucytosine, azoles, and echinocandins. These are the systemic antifungal drugs for systemic infection. For many years, we have first we will discuss amphotericin B. Amphotericin B. For many years, we use amphotericin B, but it is highly effective. But its toxicity, it is too toxic for humans. But now we have less toxic drugs. Also, we have less toxic drugs like azoles and echinocandins. These have less toxicity. Azoles are available in oral and parenteral form, while echinocandins are only available in the parenteral formulation. Then we also classify these antifungal drugs on the basis of their site site of application. We have, for systemic infection, we use oral and parenteral drugs, antifungal agents. For systemic infection, we use oral plus parenteral agents, while for mucocutaneous infections, we use oral plus topical antifungal drugs. What is amphotericin B? We have two types of amphotericin, A and B. We use amphotericin B in our daily life. Why not use amphotericin A? It is antifungal antibiotic. Amphotericin B is antifungal antibiotic produced by Streptomyces nodosus. Produced by Streptomyces nodosus. It is a bacteria. The chemistry of amphotericin B is it is actually amphoteric polyene. It is what? It is amphoteric polyene macrolide. Polyene means that it contains multiple double bonds, while macrolide is a macrolide. What is macrolide? A large lepton ring of 12 or more atoms. It is a large lepton ring of 12 or more atoms. Amphotericin B is insoluble in water, so we use how we formulate it. We prepare colloidal suspension of amphotericin B with the sodium deoxycholate to formulate the suspension of amphotericin B and for the IV use. Its pharmacokinetic properties. Amphotericin B PK properties are: it is poorly absorbed from the GIT. So why we use it orally? We use it orally for we know that it is not absorbed from GIT, but we use it still we use it orally, because for the local action, to treat the diseases in GIT, in lumen. So to treat lumen diseases, we use it orally. For systemic, we give IV 0.6 milligram per kg per day. It gives peak level of 0.3 to 1 microgram per ml. It is the peak plasma level of amphotericin B, and it is 90% protein bounded. 90% bound by the protein. Its half-life is 15 days. After 15 days, its concentration will become half, and then excrete in the urine. No dose adjustment is required for renal and hepatic impairment, and 2 to 3% drugs cross the CNS. So if we have infection in our CNS, we know that amphotericin B can't cross blood-brain barrier, so we use intrathecal injection for the infections which are present in CNS. Like for fungal meningitis, we use intrathecal injection of the amphotericin B. So let's discuss mechanism of action of amphotericin B, how it works. We know that ergosterol. What is ergosterol? Ergosterol is the sterol of the plasma membrane of the fungus, while we have human beings and bacteria have cholesterol in the plasma membrane to maintain its cell wall structure, cell membrane structure, and fluidity of the cell membrane. Cholesterol is very important in the cell membrane of humans and bacteria and fungus. Actually, amphotericin B do what? Amphotericin B bind to the ergosterol, and we know that ergosterol are present in the cell membrane of fungus. This drug amphotericin B bind to the ergosterol and alters the permeability of this cell membrane. Amphotericin is actually amphipathic in nature. Amphipathic in nature means that it have dual properties, polar and non-polar both. Amphipathic properties, it has double bond rich side and hydroxyl group rich side. This double bond rich side make its non-polar, so it's bind with this non-polar region. Double bond region bind to the ergosterol side on the membrane, on the plasma membrane ergosterol, while this hydroxyl rich side, which is polar in nature, bind to the water side of the cell inside the water content of cell membrane cells. Thus amphotericin comes and attach itself with this plasma membrane. This is the hydroxyl rich side which is inside the cell, while this is the polyene rich side which attached to the ergosterol. Then a number of amphotericin molecule comes and attach to this cell membrane and make a pipe-like structure. Here it make it like this pipe-like structure. Amphotericin comes and make a pipe-like structure in plasma membrane and led to the loss of all cell contents from the cell, and the death of the cell occur. This amphipathic nature do what? Facilitate the pore formation by multiple amphotericin molecule in plasma membrane. This pore allow the leakage of intracellular content of the fungus and macromolecules from the cell, which eventually led to the cell death. This is the mechanism of action of amphotericins. Now we discuss its resistance. How fungus show resistance to this drug? They increase the ergosterol concentration. By increasing the ergosterol concentration, and the amphotericin which we give to the dose of amphotericin which we give block the ergosterol or attach to the some ergosterol, but there are a lot of ergosterol, so our dose is less. Our dose is not so much from which bind to the ergosterol. The ergosterol concentration is higher than amphotericin, so bacteria resist itself from this drug. By decreasing ergosterol concentration or by decreasing the affinity by modifying sterol target, bacteria do what? They modify their sterol, so the target of so now amphotericin B cannot attach with this ergosterol. and the fungus protect itself from the amphotericin. What is the antifungal activity of amphotericin B? How it work against how many organisms, fungal organisms it works? Amphotericin B, it has broad spectrum against amphotericin B has broad spectrum against Candida albicans, Cryptococcus neoformans, Histoplasma capsulatum, Blastomyces, Dermatitis, Coccidioids, Emitis, pathogenic molds, Aspergillus fumigatus, and mucor species. These are the organisms these are those organisms against which this amphotericin B acts. Now we discuss its clinical uses, where we use this amphotericin B, initially used for rapid action, but then we replace this amphotericin B with the new azole for chronic treatment for immunosuppressed patients. Also we use it for fungal pneumonia, for cryptococcal meningitis, disseminated infection of endemic mycosis. For systemic infection, amphotericin B is given by slow IV infusion. We give it slow IV infusion for systemic infection, 0.5 to 1 milligram per kg per day. And we also give we inject it by intrathecal route for meningitis, and this intrathecal injection is poorly tolerated for the patient because of its side effects, inflammations, and pain, severe pain. We also use it for local topical treatment, mycotic corneal ulcers, and keratitis. For keratitis, how we use it? By using its drops, we treat mycotic corneal ulcers and keratitis. Also we use it for fungal arthritis. How we use it for fungal arthritis? We inject directly amphotericin B into the joints. Locally inject the amphotericin B into the joints. We also use it for candiduria. How we use it? We use amphotericin B we wash the bladder with the amphotericin B by bladder irrigation. Respond to candiduria, the response to bladder irrigation with amphotericin B. Now we discuss its ADR, adverse drug reaction of amphotericin B. We divide its ADR into two categories: immediate reactions of amphotericin B and slow ADR of amphotericin B. Immediate reactions are related to the infusion. When we infuse the amphotericin B, these immediate reactions occur. Infusion related toxicity is fever, rash, chills, muscle spasm. So how we decrease these we avoid from these ADR, infusion related toxicity, by decreasing the infusion rate, slow infusion rate, or by giving the pre-medication. By giving pre-medication to the patient like antipyretics, antihistamines, meperidine, corticosteroids. And also they decrease these by decreasing the infusion rate. Test dose, we give its test dose to the patient 1 milligram IV. 1 milligram IV is test dose for the amphotericin B. Its cumulative toxicity is renal damage. When the kidney become damaged, if we use if we give its prolonged dose greater than 4 gram, by using greater than 4 gram for long time, it's led to renal damage. Also intrathecal therapy led to the which we use for meningitis, intrathecal therapy of amphotericin B led to the seizures and Arachnoiditis, it is the inflammation of arachnoid matter, the brain layer, arachnoid layer of the brain, meninges. Liposomal amphotericin B. What is liposomal amphotericin B? Liposomal amphotericin B. Amphotericin B, we know that amphotericin B is toxic, because it also, we know that it attached to the ergosterol to the ergosterol and make pore in a cell membrane and led to the leakage of cell contents into the surrounding, and the cell become death. The cell become die. We decrease its toxicity, amphotericin B, by making its lipid formulation. We make its lipid formulation. Lipid package drug formulation. Lipid package drug bind to the mammal's membrane less readily, so have less toxicity. This lipid formulation cannot not easily bind to the membrane of the mammal, so the toxicity become less. Amphotericin binds to the lipids in these vehicles with an affinity between that for fungal ergosterol and that for human cholesterol. The lipid vehicle then serve as an amphotericin reservoir. This is lipid vehicle, which we called liposome. This is the reservoir of the drug. Which drug? Amphotericin. This reservoir contain amphotericin B, reducing, and it reduce non-specific binding to human cell. It cannot easily attach to the human cell. Some fungi contain lipases that may liberate free amphotericin B directly at the site of injection. We have three lipids formulation: ambisome, amphotic, and abelset. This ambisome, it is the sphere formulation, contain 3 to 5 milligram per kg per day dose. Amphotic is a it has disc-like shape, contain 5 milligram per kg per day, while abelset, it is a ribbon-like shape. It has ribbon-like shape and contain 5 milligram per kg per day dose. This is all about amphotericin B. So now we discuss flucytosine, another drug for the systemic infection. Flucytosine, it is actually water soluble pyrimidine analog. It is what? Pyrimidine analog related to chemotherapeutic agent fluorouracil. 5-flucytosine. It is 5-flucytosine. Also we call it 5-flucytosine. Spectrum of action is much narrower than that of amphotericin B. Its spectrum of action is narrower than amphotericin B. Now we discuss its pharmacokinetic properties of flucytosine. Its oral formulation is available. We take it orally. The dose of flucytosine which we use is 100 to 150 milligram per kg per day. It is well absorbed, and its peak level in 1 to 2 hours. It is poorly it's bound to the protein, albumin, globulin in blood. Penetrate in body fluid compartment. Also it penetrate into CNF. Its half-life is 3 to 4 hours. It is clear from body by the glomerular filtration. Resistance. How it show resistance? By modifying the target site, so the drug cannot bind to the target site easily. Mechanism of action of flucytosine is, when we take flucytosine, This flucytosine is taken up by the fungal cells by enzyme. This is the fungal cell, and this flucytosine is taken up by the fungal cells by enzyme cytosine permease. This cytosine permease take this flucytosine into the cell. Then into the cell, flucytosine convert into the 5-fluorouracil, and this 5-fluorouracil is converted into the 5-fluorodeoxyuridine monophosphate. 5-fluorodeoxyuridine monophosphate. This 5-fluorodeoxyuridine monophosphate is then converted into the fluorouridine triphosphate. Fluorouridine triphosphate. And this fluorouridine triphosphate led to the inhibition of DNA and RNA. This fluorouridine triphosphate inhibit DNA and RNA synthesis. Flucytosine is also used in combination with amphotericin B. It gives synergistic effect. Amphotericin B actually increase its flucytosine entry into the cell, so it gives synergistic effect. We use this synergistic effect where in meningitis to treat meningitis disease. Flucytosine is also used in combination with azole to treat the chromoblastomycosis disease. Clinical use of flucytosine is where we use it for Cryptococcus neoformans, for Candida and dermatitis mold that cause chromoblastomycosis. It is not used as a single agent. ADR of flucytosine is what is the ADR of flucytosine? Actually, when we take this flucytosine in intestine, this flucytosine is converted into the fluorouracil by intestinal flora. Intestinal flora convert this flucytosine into fluorouracil, and we know that this fluorouracil is what? This is anti-neoplastic compound which is toxic in nature. This fluorouracil is toxic for the bone marrow, and this led to the anemia, leukopenia, thrombocytopenia. Also this fluorouracil cause enterocolitis. These are the adverse drug reactions of flucytosine.